Peace be upon you, and God's mercy and blessings. This is Dr. Mohammed Youssef Kura with you. I am a specialist in internal medicine and critical care. There's a very important question that keeps coming up on the Facebook page and in the comments. I'm a diabetic patient, but I actually have the opposite problem. I suffer from being underweight. So how can I gain weight without raising my blood sugar and without exposing myself to health problems, really? After doing some research and looking into the matter, we found out that we can actually do this in a way that's the complete opposite of intermittent fasting. So what does that mean? When we were doing intermittent fasting, we used to eat just one meal a day, or at most 2 meals, within a very short window, about 8 hours or less, depending on what we could manage. And for the rest of the day, we wouldn't eat anything. We rely for the rest of the day on drinking water, or even tea, or anything else that doesn't raise blood sugar. And at the same time, it doesn't increase. Calories, or it doesn't give the body any calories. And as a result, a person starts to lose weight gradually. But for people who want to gain weight, they can do the opposite. They can eat more than 2 meals a day. They can have 3, 4, or even 5 meals. But if we remember, in intermittent fasting we said, what kind of food are we supposed to eat? It should mainly be protein. And we should reduce carbs as much as possible, and also cut down on fats as much as we can. And basically, there should be 0 sugar. That way, we're able to lose weight. But the point here is that we weren't taking in a lot of calories, or we were actually consuming fewer calories than what the body needs. So, the body starts to lose weight gradually. But here, we're going to do the opposite. We'll eat 2, 3, 4 meals, or however many meals we decide to have. But the idea is that we'll be eating more calories than what the body actually needs. But it will still mainly be through foods that are primarily protein. And we'll also do the same thing. Keep the carbs very low. Sugar is almost completely forbidden, and maybe just a very small amount of fat. Through our research, we also found a food that can provide all of this. It's something very simple, widely available, very beneficial, doesn't need to be cooked, and you don't have to spend a lot of money to buy it or anything like that. And it also has a lot of benefits. So what is the ingredient we're talking about? It's sesame. Imagine that sesame, about 15 grams of it, or 3 tablespoons, contains roughly 600 kilocalories. And a normal, average body, let's say someone who weighs 70 or 80 kilos and isn't very active, they need about 1,500 calories a day. So if you include sesame in your diet throughout the day, several times a day, you're basically helping your body gain weight. And the surprise is that sesame is actually very rich in protein and contains a reasonable amount of fat as well. You could say it contains a lot, but the fats in it are unsaturated and not harmful. Additionally, it contains almost no carbohydrates at all. Therefore, sesame helps with weight gain for diabetics without causing harm. And there's an even bigger surprise. Sesame lowers blood pressure and reduces blood sugar levels. And this is another added benefit that will be very useful for both diabetics and people with high blood pressure. In addition, something extremely important is that sesame contains a very high amount of calcium. The calcium content in sesame is high. Therefore, it provides a very important nutrient for bone density and bone strength. And of course, when the body gets vitamin D or is exposed to sunlight, it can metabolize calcium well, which makes it very beneficial. So, we find that some people who are allergic to milk, or who don't like milk or dairy products, or who are allergic to eggs and want to get calcium but can't find a readily available source, can benefit from this. So, we find that sesame is also a very sufficient source of calcium. And so, if we make sesame a main part of our diet, For diabetic patients who want to gain weight, they'll find that their weight increases, and it increases through good proteins and healthy unsaturated fats. It doesn't contain starches or sugars. In addition, it lowers blood sugar and blood pressure. It also gives us a very high amount of calcium. I hope, God willing, that today's episode was helpful for you and that we answer the question thoroughly. See you soon, God willing. Thank you all, and peace be upon you and God's mercy and blessings.